Gastrointestinal endoscopy, often referred to simply as GI endoscopy, is a procedure that allows doctors to examine the inside lining of your digestive tract using a flexible tube equipped with a light and camera. This remarkable tool has revolutionized the way we diagnose, monitor, and treat a wide range of conditions affecting the esophagus, stomach, and intestines. But when is a GI endoscopy truly necessary? Understanding the indications, benefits, and considerations for this procedure is essential for anyone seeking to take control of their digestive health. First and foremost, GI endoscopy is commonly recommended when patients present with troubling symptoms that cannot be easily explained by routine exams or laboratory tests. Persistent abdominal pain, difficulty swallowing, unexplained weight loss, chronic nausea or vomiting, or gastrointestinal bleeding. These are signs that something deeper may be happening within the digestive tract. An endoscopy enables doctors to look directly at the mucosal surfaces, identify abnormalities, and even obtain tissue samples for further analysis. One of the most urgent indications for a GI endoscopy is gastrointestinal bleeding. Blood in the stool, whether bright red or dark and tarry, can signal a serious problem such as ulcers, tumors, or varices. In these scenarios, an endoscopy is both diagnostic and therapeutic. Not only can the source of bleeding be identified, but doctors can also intervene immediately, cauterizing bleeding vessels, applying clips, or injecting medications to stop the hemorrhage. This capability makes endoscopy a life-saving tool in acute settings. Another crucial reason for GI endoscopy is the investigation of persistent upper abdominal pain or indigestion, particularly when these symptoms do not respond to standard treatments. Conditions like gastritis, peptic ulcer disease, or even stomach cancer may not always be visible on imaging studies like ultrasound or CT scans, but they can be detected directly with endoscopy. For patients with a history of chronic heartburn or acid reflux, endoscopy may be necessary to assess for complications such as Barrett's esophagus, a precancerous change in the lining of the esophagus. Endoscopy is also vital for diagnosing and staging cancers of the digestive tract. When a patient has unexplained weight loss, difficulty swallowing, or a family history of GI cancers, endoscopy allows for direct visualization of suspicious lesions as well as targeted biopsies. This is especially important in distinguishing benign conditions from malignant ones, guiding treatment decisions, and planning further interventions. Screening is another domain where GI endoscopy plays a pivotal role. Colonoscopy, a type of GI endoscopy, is routinely used to screen for colorectal cancer in adults over the age of 45, or earlier in those with risk factors such as a family history of colon cancer or inherited syndromes. By identifying and removing precancerous polyps during the same procedure, colonoscopy significantly reduces the risk of developing colorectal cancer in the future. In patients with chronic diarrhea, malabsorption, or unexplained anemia, endoscopy can help uncover diseases such as celiac disease, Crohn's disease, or ulcerative colitis. These conditions often present with subtle changes in the intestinal lining that can only be detected by direct examination and biopsy. For those with iron deficiency anemia that cannot be explained by dietary factors or blood loss from other sources, endoscopy may reveal hidden sources of bleeding, such as small ulcers or vascular malformations. The procedure is indispensable in monitoring known diseases. Patients with a history of polyps, Barrett's esophagus, or inflammatory bowel disease often require regular endoscopic surveillance to ensure that their condition remains stable and to catch any early signs of progression. This proactive approach allows for timely intervention, minimizing complications and improving long-term outcomes. GI endoscopy is also used therapeutically. For example, in patients with strictures or blockages in the esophagus, stomach, or intestines, endoscopy can be used to dilate the narrowed areas, restoring normal passage of food and fluids. In those with bile duct stones or tumors obstructing the duct, endoscopic procedures can remove stones or place stents to relieve blockages. These interventions can be performed without the need for major surgery, reducing recovery time and risk. Despite its many benefits, GI endoscopy is not performed indiscriminately. There are specific criteria and guidelines that determine when the procedure is appropriate. Doctors take into account the patient's age, medical history, risk factors, and the nature of symptoms before recommending endoscopy. For instance, in a young person with mild indigestion and no alarm symptoms, a trial of lifestyle modification and medication may be preferred before proceeding to invasive diagnostics. Conversely, in older adults or those with high-risk features, early endoscopy may be warranted to rule out serious conditions. It's important to recognize that endoscopy carries some risks, though they are generally low. Complications such as bleeding, infection, or perforation of the digestive tract are rare, especially when performed by experienced specialists. Patients are typically sedated to ensure comfort during the procedure, and recovery is usually swift, allowing most people to return to normal activities within a day. Preparation for GI endoscopy varies depending on the part of the digestive tract being examined. Upper endoscopy involves fasting for several hours to ensure the stomach is empty, while colonoscopy requires more extensive bowel preparation to clear the intestines of stool. The quality of the examination and the accuracy of findings depend heavily on proper preparation, so patients are given detailed instructions in advance. In summary, GI endoscopy is necessary in a variety of situations, from unexplained symptoms and acute emergencies to screening and ongoing disease monitoring. It offers unparalleled insight into the health of the digestive tract, enabling early diagnosis, targeted treatment, and effective prevention. If you or someone you know is experiencing concerning digestive symptoms, discussing the potential need for endoscopy with a healthcare provider is a wise step toward better understanding and managing your health. Ultimately, the decision to undergo GI endoscopy is a collaborative process between patient and physician, balancing the potential benefits with individual risks and preferences. With its ability to detect hidden diseases, guide treatment, and improve outcomes, GI endoscopy remains one of the most valuable tools in modern medicine for those seeking answers to their digestive concerns.